Hey guys, it's Dave. Today we're going to talk about IBS, or irritable bowel syndrome. Irritable bowel syndrome is a chronic disease, which means you're really in for the long haul. Everybody has a lot of the symptoms of irritable bowel syndrome, whether it be constipation or the diarrhea or mixed at some time during your life, mainly brought on by stress. However, to be truly diagnosed with IBS, you need to experience these symptoms and signs for over a 6-month period. And really, serological testing is what makes a diagnosis, because it rules out things like a gastrointestinal infection, inflammatory bowel disease, or even celiac disease, which is getting to be quite common. What happens is you will get abdominal pain with altered bowel movements, whether you're normally a one-a-day type person or a one-every-other-day type person. Suddenly you may see once a week or maybe 5 times a day. And so it really is a change that is a drastic change from what you normally have. You also have a lot of distension with gas, as well as severe cramping that will just really hit you hard, can double you up. You also can see some mucus in your stool as well, and incomplete evacuation of your bowels. So you think you're done, but you're really not done. You're having issues with that. It is more common in men or women than men, and the main age that it hits is 15 years to 45 years in age. As far as the different types, there's IBS-C, which is IBS with constipation. There's IBS-D, which is IBS with diarrhea. IBS-M, which is mixed. You can go one way or the other. Or IBS-U, which is an unsubtype. You really can't classify it as having any of the above 3. IBS-C, or IBS constipation, is the major type. The majority of cases you'll see with that. It can be treated a lot with diet. The majority of the time that you have any of these, stress can actually be one of the major issues that can bring about symptoms or signs of having IBS. So with all of them, if you can decrease your stress levels, it helps. I know that's tough to do, but there are ways to do that. If you increase your activity, you get in exercise every day or almost every day, not only does it decrease your stress, but it helps to get things moved along in your GI tract as well. As far as tobacco use, if you're smoking, you're vaping, you're chewing, they can all cause exacerbations of the disease. So you really, if you're a smoker or a chewer, try and get that cut out. Certain foods can also set it off. Cabbage, carbonated drinks. So, you have carbonated water, pop especially can set it off. Citrus, because of the acidity in there, or orange juice, grapefruit juice can set it off. Beans, of course, can cause a problem. It's going to give you gas. That will set it off. Dairy is a big one. That can cause all kinds of problems. Lactate, things like that may help a little bit, but it's not going to knock it out. Wheat can also set you off. So you really want to watch what you're eating and look at the label, what's involved in that, because a lot of things you don't even realize that dairy would be in there or wheat would be in there, and it is. The proposed cause of IBS is actually a disorder of the brain-gut axis. And the more we learn about the brain-gut axis, the more we realize how it's tied into a lot of chronic disease, especially associated with inflammation. 50% of all patients that have IBS have actually a diagnosis of anxiety or depression with it. Is it because, you got IBS, so you're depressed because of the IBS? Possibly. But it could be associated with this brain-gut axis that we're talking about. So if you can get your gut healthy, you may be able to get rid of the depression and anxiety, as well as help your IBS with it. Serotonin dysregulation has been linked to IBS. So serotonin is it's needed as far as keeping depression at bay. So if you have serotonin dysregulation, and in this situation with the diarrhea, your serotonin is actually too high. So if we can get that regulated, we can get this under control, as well as the depression. Severe infections, especially gut-related infections, have been linked to IBS, as well as muscle issues. So if you have muscular dystrophy, multiple sclerosis, those kind of diseases, you absolutely could be at higher risk for IBS. Also, changes in your gut microbiome. So if you're on long-term antibiotic use like vancomycin, doxycycline, you could be at risk for IBS. As I said, everybody can have occasional issues with IBS symptom-like problems. Usually stress is what brings those on. But if you have a family history or a history of gastroenteritis, or if you're a lady that's on estrogen treatment or therapy, you're going to be more prone to have IBS. So be aware of that ahead of time. IBS-C, or the constipation aspect of it. There are a few drugs that you can take that may help you out that are prescription. Linzess is the main one, and it is strongly recommended by the American Gastroenterology Association. It is due to two mechanisms of action. The first is increasing your GI motility to get things moving through your gut so you're more regular. And the second is to decrease the visceral hypersensitivity, so it again helps to keep things going so you don't get bound up. Some other ones that are out there are Trulance, which is another expensive one, Zelnorm, Ibsrela, and Amitiza, which is now generic, but a lot of insurances don't cover the generic. All of these, you need to make sure you're drinking a lot of water. Some other medications that they've tried with some success, mixed success, are antispasmodics like dicyclamine, metoclopramide. Those have had some different success levels with it. Remember, with a lot of those, they'll really dry you out, so you need to drink a lot of water. You can see dry eyes, dry nose, dry mouth. Be aware of that. Laxatives, of course, can help, as well as some antidepressants have been used with mixed results there as well, because some of them can actually dry you out even more, causing more constipation. But then you also need to remember, like I said, with the gut-brain axis, probiotics are very good for you as well. Get on a good one. I like Florigen as well as pure encapsulations. The other side of the coin with IBS is IBS-D, or IBS with diarrhea. Here, there's not near as many choices for medications. You can use Viberzi, which is a controlled medication. It helps to slow the motility down, so you're not having things rush through your gut. So you may not see as much diarrhea with it. Lotrinex is another medication you can use. An expensive one that's out there but has had cure rates with it is rifaximin. That one is an antibiotic that actually alters the gut biome. You don't have to be on it long term like the rest of your life. It is a treatment course that once you run the course, it's either going to cure you or it's not. Again, it's very expensive. You'll probably need a prior authorization for your insurance to cover it. They also use antidepressants, or loperamide, which is Imodium over the counter, bile acid sequestrants like cholestyramine, which help to bulk up your stool so you don't have it moving through your system as fast. Again, probiotics are another good thing that you should try. And even though you don't think about it, with IBS diarrhea, you still need to keep yourself hydrated, because if you don't, you run your risk to have your electrolytes knocked off. IV Fluid IV would be a good, liquid IV would be a good source. You can get it over the counter to make sure that your electrolytes don't get off. For treatment with mixed or with IBS constipation or IBS diarrhea, some other things that you need to remember. Number one, fiber. You need to get good fiber in every day, no matter what. If you use things like Metamucil, that's absolutely fine to get one in every day. Side note, that can also help lower your cholesterol as well. Water, very important in both situations and in mixed as well. Exercise, keeping moving every day is good as well. Acupuncture and yoga have been found to help out as well. Now, it can help decrease your stress levels as well as increase your movement. So remember that. And the acupuncture's been mixed, but if you talk to your chiropractor or your acupuncturist, they'd be able to help you out with what works best. Some other things that have actually helped out is decreasing fermentable products such as sauerkraut. That can cause a lot of distension, gas, and problems that way. The other thing that diet related that they have found that has really helped out with IBS is decreasing the amount of oligo, di, mono, and polysaccharides. The reason is they're poorly absorbed in the GI tract, so they're not going to really help you. They're empty calories, but they lead to gas and distension. If you cut those out or decrease those greatly, you can actually see improvements within 2 to 6 weeks. And by eating things low in those, such as cantaloupe, grapes, kiwi, strawberries, blueberries, zucchini, cucumbers, eggplant, eggs, unprocessed meats. And that's hard. You got to stay away from a lot of the fast food joints because they use a lot of processed foods in general, but especially processed meats. So go back to the butcher, go back to your grocery store and hit those kind of meats. Tofu, oats, rice, and non-dairy milk. So your soy milk, your oat milk, your cashew milk, your almond milk, those things are really good to help out with that. Also, if you happen to have a lot of weight loss that's occurring, that you're not trying to lose weight, you're not exercising, you're not on a diet, if you ever experience rectal bleeding or blood in your stools, diarrhea that's occurring just through the night, vomiting, or continual abdominal pain with no relief, you need to see your doctor. A CT scan, a colonoscopy, or an endoscopy needs to be done to see if it's something more serious than IBS.